Hello and welcome. I'm Professor Khalid Khan from University of Granada in Spain. Today we will talk about gender-based violence. Other synonyms for the same problem include domestic violence and intimate partner violence. To discuss the topic with me, I have Professor Aurora Bueno. Aurora, please could you introduce yourself?
Hi, Khaled. I am Aurora Bueno Cabanillas. I am professor of preventive medicine and public health at the University of Granada and the head of the Department of Public Health at this university.
Okay, we're going to discuss these two papers that we co-authored with other colleagues in our department. One of these passed the 100 citation mark recently, so we are proud of our interdepartmental collaboration. Aurora, to set the scene, might you give a bit of an introduction to the topic?
Okay, I want to remember that violence against women is a really important public health problem. It's prevalent, affecting more than 1 in 10 women worldwide. It's severe. I can't imagine any other disease affecting quality of life as much as violence against women by her partner. And without any doubt, it's a health issue. Injuries are the more visible consequences, but not the most frequent or severe. Being exposed to physical, psychological, or sexual violence affect women's health in an integral way, damaging physical, mental, and social well-being. The last question, is it intimate partner violence preventable? Experts say that at a primary level, undertaking common risk factors as poverty, gender inequality, social norms can help. Secondary prevention is focused on early detection. Violence against women is always a hidden problem.
Okay, now because it is a hidden problem, uh, how can the health system help? This is something we are going to cover in this video. So to begin with, we demonstrate through the findings of our papers how the health system could potentially screen women. Aurora, could you say something about the first of the two papers that we want to cover today?
Well, we started thinking that uh, the first we need to do is to show the relevance of the problem with real data. So we undertook an umbrella review where we look for previously made systematic review. We could include 12 systematic review. The quality of those reviews was quite low, and they don't capture the totality of the disease burden in intimate partner violence in pregnancy, with figures ranging from 2 to 50%. But the problem was that they were strongly biased and they mix intimate partner violence with gender-based violence and domestic violence.
Okay, so because of the variation in the quality of these reviews, we could not be confident that the data they summarized and presented was trustworthy for informing public health practice. Aurora, what did we find in our own systematic review?
Well, uh, with a systematic strategy for searching, we found almost 2,000 papers about intimate partner violence prevalence. Finally, we include 152 studies Information referred to more than 200,000 pregnant women, coming from all the colored countries in the map below. Can you show the map?
Yeah.
Thank you. Global prevalence figure were 9.3% for physical violence, 18.7% for psychological violence, and 5.5% for sexual violence. We combine all kinds of violence. The prevalence was as high as 25%. That is, 1 out of 4 women are exposed to any kind of intimate partner violence during their pregnancy.
Well, this is a seriously high rate of the problem in society for women. What are its consequences, Aurora?
The consequences are multiple. Uh, we can find some physical problem like chronic pelvic pain or sexual problems. We can find mental problems like depression, and we also are going to find reproductive problem, premature birth, prematurity, low birth weight, and an increase in mortality of the baby and the mother.
Okay, so looking at it with the healthcare provider point of view, we are dealing with a problem that is causing mental health problems, that's causing sexual and reproductive problems, but also it's causing a serious outcome like death or serious physical injury. Um, the responsibility at the time when a woman presents with a fracture in the emergency room is to fix the fracture. But by this time, it is too late. The woman has already suffered the treatment she's given by her intimate partner. In this case, Aurora, how can the health system proceed? One thing that is highlighted in this slide, and you pointed to earlier, is called somatization disorder, where women present with various symptoms to different health services. And because these specialties are not linked to each other, they tend to treat each presentation in isolation and don't make the link with the repeated various presentations with symptoms in different organ systems. Therefore, an opportunity to screen may be missed over there, isn't it, Aurora?
Early detection is the key, I think. Screening is really important. Uh, can you show the next slide? It's really important to connect social services with health system. If you can see in the high part of the slide, the number of reports are increasing through the last year, but not the protection order, not the response of the social service, of the police system. In the low part of the slide, you can see the source of the complaint, the source of the report and the violence. More than 2/3 come from their own victims, family member, other person, or direct police intervention are military, and the report of the health professionals are really scarce. And this is because there aren't a good connection with social services. Health professionals don't know if the report is going to have a good or a bad consequence for the women. So we need to improve this point.
Okay, Aurora, how will we bring this discussion to conclusion?
Well, the first point is that we need to realize that gender-based violence is a really common problem. It's a frequent human rights breach. Second, screening can make a difference. Early detection is really important and everyone needs to take part in early detection. Of course, health systems should be coordinated with social services, and the police and justice system need to find innovative solutions to be.
Yeah, Aurora, thank you very much for sharing your public health perspective on this very serious problem that presents itself across the various societal systems, including the health, social services, police, and justice system. And we hope that these all can be coordinated better to give the best possible protection to women that is possible at this time.
Thank you very much.
Thank you.